Welcome to the podcast. Before we begin, there is a disclaimer we have to make. Let's Talk Wellness Now brings expert insights directly to you. Please note that the views and information shared by our guests are their own and do not necessarily reflect those of Let's Talk Wellness Now, its management, or our partners. Each affiliate, sponsor, and partner is an independent entity with its own perspectives. Today's content is provided for informational and educational purposes only and should not be considered specific advice, whether financial, medical, or legal. While we strive to present accurate and useful information, we cannot guarantee its completeness or relevance to your unique circumstances. We encourage you to consult with a qualified professional to address your individual needs. Your use of information from this broadcast is entirely at your own risk. By continuing to listen, you agree to indemnify and hold Let's Talk Wellness Now and its associates harmless from any claims or damages arising from the use of this content. We may update this disclaimer at any time, and changes will take effect immediately upon posting or broadcasts. Thank you for tuning in. We hope you find this episode both insightful and thought-provoking. Listener discretion is advised. Now for the show.
Hello, and welcome back to Let's Talk Wellness Now. I'm your host, Dr. Deb, and today we're diving into a topic that has touched the lives of millions and has far-reaching implications in our healthcare system: misdiagnoses. Each year, an estimated 12 million adults in the United States are affected by diagnostic error. That's 1 in 20 patients who leave the doctor's office with a label that may be wrong or worse, without answers at all. This isn't just about missed or misunderstood diagnoses. It's about lives turned upside down, families left searching, and healthcare systems that sometimes overlook the root causes of chronic illness. In my practice, I see firsthand the devastation caused by these diagnostic failures, particularly with complex conditions like Lyme disease and toxic-related illnesses. And when you dig deeper into the numbers, the implications are staggering. A report by Johns Hopkins University found that diagnostic errors contribute to over 80,000 deaths annually in the US, making them one of the most significant public health crises of our time. Today, we're going to take a look at some of the real stories behind those statistics, including cases that my very own Dr. Brown, who works for me, shared on the popular show Monsters Inside of Me. Let's jump right into this. So let's start with Lyme disease. It's often called the great imitator because it mimics so many other conditions. According to the CDC, over 476,000 people in the US are diagnosed and treated for Lyme disease each year. I would say my personal opinion is that that number is probably a little bit lower. And I say that because I know the number of people that I see in my office that have had a negative test result done conventionally. And then we do a gold standard test through a company called IGeneX, and we get a positive. I also know there's been some issues with the reporting of these cases as well to the health department. One time, my office called the health department to report a case in February, and we were told by the healthcare worker that they weren't taking any new cases for the year. And we were perplexed. We thought, what are you talking about? This is a communicable disease that needs to be reported, and you're telling us you're not going to take the case and report it? And when we questioned it, the answer from the person on the other side was we had already met our quota for the year. And again, we questioned, there is no quota in a reportable disease. And she refused to take the information from us. So we know that some of these statistics are not as accurate. These numbers could be much lower than what we're actually seeing reported. But the true number may be even higher, as we've said, given how frequently the disease is misdiagnosed as chronic fatigue, fibromyalgia, and even psychiatric disorders. Patients suffering from Lyme often report symptoms that include extreme fatigue, muscle pain, headaches, neurological issues. Yet many are misdiagnosed with a mental health condition like depression, anxiety, and their unexplained symptoms are often dismissed as psychosomatic. Take, for example, a patient who was misdiagnosed for years, treated for everything under the sun except the actual cause, Lyme. After being prescribed antidepressants and painkillers, along with even sedatives, they still didn't improve. What's even more shocking is the testing issue. Standard Lyme tests are notoriously inaccurate. They raise false negative rates for Lyme tests that can reach as high as 50%, leaving patients in limbo while their symptoms worsen. These are isolated incidences, you say? These are systemic failures. Now, here's where Dr. Brown's work came in. On the show, Monsters Inside of Me, Dr. Brown highlighted a case where a patient had been living with Lyme for years, but had been told repeatedly that it was all in her head. Her symptoms only worsened. This individual was prescribed multiple medications for anxiety, and yet those symptoms progressed and worsened. After exhaustive testing and a new approach, they were finally correctly diagnosed with Lyme disease. But how many patients never get that second look? How many endure years and even decades of mistreatment? Lyme isn't the only example of misdiagnosis in complex chronic illnesses. Another hidden and often ignored issue is environmental toxin exposure. Toxins come from various sources: mold, heavy metals, pesticides, herbicides, insecticides, industrial pollutants. Our very own World Health Organization, the WHO, estimates that 23% of global deaths are linked to environmental factors. Yet in traditional healthcare, toxin exposure is rarely considered a root cause. Take mold toxicity for an example. Despite an estimated 50% of the US buildings showing signs of mold contamination, mold toxicity is still misdiagnosed as allergies, asthma, or a mental health disorder. People experience symptoms like fatigue, brain fog, joint pain, and digestive issues, and yet they're all told it's just IBS, irritable bowel syndrome, or it's stress related. But mold toxicity is more than just a nuisance. It's a serious neurotoxin that can wreak havoc in the brain and in the immune system. One case from my practice stands out: a patient in her 40s who was misdiagnosed with early onset dementia. Her memory was deteriorating and her cognitive abilities were declining. She had been to numerous specialists, all of whom concluded it was a rare form of dementia. But after conducting specific tests, we found that her home had severe mold problems, which was causing the neurotoxicity. When we removed the mold exposure and began detoxification, her symptoms started to improve, and it was a life-changing diagnosis for her. She could have spent decades in a nursing home, spending hundreds of thousands of dollars on medications that wouldn't have worked for her because they were the wrong medications. It's important to advocate for yourself, to trust your own instincts, and ask questions of your practitioners. Tell the story of how you got sick. Look at your story of what was going on before you got sick so that you can see if there's any links or connections to any of these conditions. These examples are why we need to challenge that status quo in healthcare. Stories like these aren't rare. They're alarmingly common. The British Medical Journal, Quality and Safety Journal report that 12 million Americans are misdiagnosed every year. Yet, how often are these errors truly investigated? Lyme disease, mold toxicity, chronic viral infections, these are just a few examples of illnesses that often go undetected or mislabeled. Autoimmune diseases are another area where misdiagnoses runs rampant. Conditions like fibromyalgia, chronic fatigue syndrome, often serve as a catch-all diagnosis when doctors don't have a clear answer, but autoimmune symptoms can sometimes be linked to chronic infections or environmental toxins, issues that conventional medicine rarely digs into. Let's talk about the system itself. In mainstream healthcare, there's a reliance on testing protocols and standard treatments that often don't account for the unique complexities of each individual. There's a famous quote by Dr. Marty Markery from the Johns Hopkins, who stated that the third leading cause of death in the United States is a medical error. And diagnostic errors are a big part of the issue. When we focus solely on symptoms without exploring underlying causes, we're not truly serving the patient. RFK Jr. and other advocates of medical freedom have called for the reevaluation of our healthcare system, a system that too often dismisses patient concerns, relies on outdated testing, and doesn't prioritize environmental and nutritional factors. They've pushed for transparency in medical practices and have highlighted the dangers of ignoring environmental triggers in chronic disease. And I fully agree with this perspective. This isn't about controversy for the sake of it. It's about doing what's right. Our practice takes a broader approach for precisely this reason. We consider environmental exposures, nutrition, lifestyle, and advanced lab testing that goes beyond the basics. It's about giving the body what it needs to heal, not just trying to suppress symptoms. And yes, this sometimes involves treatments that are considered alternative. But what matters most is that the patients are finally finding relief. It's time we start demanding that healthcare addresses the root cause, not just the symptoms. If we don't, we're only going to see more cases like those on Monsters Inside of Me, where patients endure unnecessary suffering simply because no one questioned the initial diagnosis. Moving forward, Let's Talk Wellness Now will tackle these hidden truths behind misdiagnoses. We'll explore the complexities of conditions like Lyme, mold toxicity, chronic infection, autoimmune disorders in detail. And we'll have expert guests joining us like Dr. Brown to shed light on these challenging issues. My goal is that by the end of each episode, you feel informed, empowered, and equipped to advocate for your own health and your loved ones. The mainstream approach to diagnosis and treatment has its place, but it's not the only path. Here, we're opening up the conversation, challenging the status quo, and offering alternative insights, not just for the sake of being controversial, but because every patient deserves a fair chance in healing. So if you're struggling with a diagnosis that doesn't quite add up, it doesn't quite feel right, but you're being told that this is all in your head, or if you feel like you're constantly hitting the wall in healthcare, I encourage you to tune in each week. Let's shine the light on these hidden monsters within our medical system and reclaim the power to control our health. Thank you for joining me today. I'm excited to continue this journey with you as we explore the real, sometimes difficult, and ultimately empowering path to true wellness.